So how common is it for fruits or vegetables to grow inside of the human body? We're going to ask Dr. Sampson Davis that. He's joining us now from New York to discuss these issues. We also want to ask you about male menopause, or manopause, as we've been calling it around here. But back to that story about the pea. I mean, what are the chances, doctor, of this happening?
Yeah, this is a very unique story. I mean, for a pea to grow inside somebody's lung is simply amazing. I mean, first of all, you have to consider that the pea went down the wrong pipe. He inhaled the pea, and the fact that the pea must have been raw, because if it was a pasteurized pea, there's no way it could have grown. The only sense that I can make of it is that it was in a dark environment and was able to germinate and sort of sprout, but it wouldn't have continued to grow because it needs light, of course, and water in order to grow.
And he did say it was only a half of an inch. And he certainly had a sense of humor about it, I guess, which is kind of good, though. But turning now to something that, you know, you may want to kind of laugh at, but maybe it isn't something to laugh at, male menopause, because a lot of people would be quite confused about this. According to an article on CNN Health, between 1999 and 2008, the number of prescriptions filled in the U.S. for testosterone gels, shots, patches, the first-line treatment for most men, it increased by more than 400% to 3.3 million. But you say that low testosterone or male menopause is actually very uncommon, though. But what are the symptoms?
Well, actually, menopause or menopause is common in the sense that testosterone levels as we age drops. At the age of 40, about 1% each year, our testosterone level would drop. As a recent, so that's part of the common aging process, but as a recent, people started to label it as something that we need to treat. Some of the symptoms includes fatigue, obesity, headache, decreased physical activity, decreased libido. But with that said, you know, we have to be, as a word of caution, because if you start to take testosterone supplements, there's risk factors associated with that. One is increase in red blood cell production, and that can lead to heart attacks, and that can lead to stroke. So, you know, you just have to be careful and realize that before seeking treatment, you should, one, document your symptoms and make sure that it's symptoms that's ongoing for a period of time, as well as your testosterone level needs to be low consistently for a period of time.
So you say people shouldn't jump the gun because there are these side effects, and it's true, right? You could also see the same symptoms because of other conditions. So how tricky is it to really diagnose this?
It is very tricky. I mean, depression can present this way. Low thyroid can present this way. Sleep apnea can cause some of the symptoms that you may experience. So the main thing is during your yearly physical examinations that you should have a testosterone level drawn, and then you should document. I like to break up into three categories. One is physical. Are you less active? One is psychological. Are you not sleeping well? Do you feel depressed? And then the last is sexual. Do you have decreased libido? Those three categories, along with a prolonged period of time where your testosterone level is low, then that may advocate for treatment. But I would still, you know, even though you may get treated, doesn't mean that you will start to improve with the testosterone. Some people don't improve when they receive testosterone treatment, so then therefore you have to decrease or stop the therapy, obviously.
Okay, and then I guess the other bit of advice would be to get your yearly physical if that's when you should be checking it, because I know a lot of people are certainly not that diligent about doing it. But all good tips. Dr. Sampson Davis, thank you so much for joining us. Really appreciate it.
Thank you for having me.